Welcome to HealthWatch, presented by Novant Health. I'm June Baker, and I'll be your host today. We have a great show planned for you, and I'm really excited to be able to share it with you. Our first guest is Skip Allen, and he's the outreach dietitian for Novant Health New Hanover Regional Medical Center. And then we're going to talk about all kinds of vaccines with Tammy Waterman, who's a clinical pharmacist here at Novant Health Brunswick Medical Center. And lastly, we'll meet Shannon Mathis, the nurse practitioner at Novant Health Gastroenterology, Brunswick. So stay tuned for this exciting episode of HealthWatch. Please welcome my first guest, Skip Allen, the clinical outreach dietitian at Novant Health New Hanover Regional Medical Center. Hey Skip, thanks for coming today.
Thank you. Thanks for having me.
Great to have you. You know, I think you're our first dietitian.
That's exciting.
It is exciting, and you're kind of a special dietitian. I mean, you're not your normal one that works in the hospital, in the cafeteria. So first, let's learn a little bit about you, your background, where you went to school, things like that.
Okay. Yeah. So I started my education at UNCW.
Oh.
So I love Wilmington. I was here for a long time in college. I studied exercise science as an extension of physical and health education. After that, I spent some time as a personal trainer and as a coach, but I went back to school and got my master's. This time I studied nutrition. I went to Meredith College in Raleigh.
Oh yeah, that's a nice school.
Yeah, and I'm from Raleigh, so that was fun to be back then. And then after that, I spent a year doing an internship to become a registered dietitian.
Awesome. So you are a registered dietitian, but you have a specific skill set, I understand. So tell me about that.
Yeah. So what I do is a little different. I work as an extension of the inpatient team over at New Hanover Regional Medical Center. So as you mentioned, I'm not in the hospital very often. I work as a follow-up service for the patients who are leaving the hospital typically. And then also I work in the community here in Brunswick County and New Hanover County for some of the primary care facilities. Again, I'm based out of the hospital, but I try to reach out to the community and provide that care and bridge that gap a little bit more so that the patients don't have to be at the hospital to receive some nutrition care.
So you're an outreach type person. You go out into the communities, and you say you do cover Brunswick County?
I do, yeah. So I've got a couple different populations we work with, but right now I am doing some services for patients diagnosed with diabetes, and that service is extended actually anywhere in North Carolina, but right now we're focused on trying to get some folks in Brunswick County aware of that.
And do you, you don't see only diabetes patients, do you see a number of patients?
Yeah,
is that correct?
Yeah, so I see patients when they're leaving the hospital. There's some specific groups that need some care when they leave, somebody to follow up with them. And for those patients, I do home visits, which is also very unique. Yeah. Not many dietitians are doing home visits. But then also for the diabetes care and some of the nutrition education, we're using the computer software, telehealth services, Zoom, some of the other platforms, so the folks can be at home. They don't have to go to an extra physical visit. They can actually just receive those services where they're at. And again, for folks in Brunswick County, we want to make sure that anyone in the county has access to that resource.
If they don't have a computer, can you do it over the phone?
Yeah, we've done it over the phone, and I do like to send information through the computer, email. Sometimes I share some visual screens, some education tools, but if a patient prefers the phone and is comfortable with that, I'm happy to have a conversation with them.
For those folks anywhere watching this, do they need a referral from primary care, or can they just contract straight with you or New Hanover?
Yeah, I mean, if you think you need the nutrition education or would benefit from it, they do need to speak with their primary care physician or one of their specialists and have them send that referral over. From there, I can contact them directly to make it a little bit easier for them to get that appointment. I also do the scheduling for them, so hopefully if they can get that referral from their doctor, it shouldn't be hard for us to reach them.
Let's talk a little bit about blood sugar. I hear a lot about it, not too familiar with it, but folks with diabetes, they can kind of help themselves by keeping track of their blood sugars, correct? And how do they do that? Do they have the finger stick or?
Yeah, a lot of my patients do. You can find a glucometer. You can find that at the local pharmacy. You can get it at Walmart. You can order them online. Many times they're covered by insurance, so you could check with your insurance if they cover that for you as well. That is the most popular way I see folks checking things. Another way is a continuous glucose monitor, and again, some folks qualify for those through insurance, so speak with your doctor. You may be able to get a trial or something more long-term. And then outside of that, just having regular checkups with your physician, even if you're not checking things daily, having those monthly or quarterly labs done would be useful for checking those numbers as well.
I know diabetes education is kind of hard to come by in this area, but in exchange for that, maybe if they just contracted with a dietitian, that might help them achieve their goal too.
Yeah, and the nice thing for our services is right now we can take Medicare, Medicaid, and any private insurance. So I know sometimes for folks in the Medicare, Medicaid group, that's a harder service to find. So we're really hoping that, again, as an extension of that hospital care, we can reach out to some groups that maybe need that haven't had access to it in the past.
I wanted to go back to something you said about the continuous monitor. Is that the one I see on TV, the ad, and it's on their arm and they put their, how does that work?
Yeah, so there's a couple versions of them. Some are more popular than others, but they link up with your phone and they are able to kind of track that data remotely through the application that comes with the actual monitor. That information goes to you and your doctor, so that is something that you can keep an eye on, but also if you don't feel like you understand or you want someone to talk to about it, your physician sees that information as well.
Well, but I'm going to ask you a stupid question. How does it read it if it doesn't have blood?
Yeah, it sticks. I actually don't know.
I think that is the coolest thing if that's what it is and no sticks.
Yeah, it's a lot more comfortable.
Well, I'm going to have to research that because I've been watching that ad on TV and I can't figure it out.
Yeah, no, it's a lot more comfortable, and yeah, when you find out, you let me know.
Okay, that's a good idea. Typically, how long do you see a patient? Do you have them for weeks or days or?
Yeah, so what I like to do is at least have somebody speak at least 2 times. I try to have an initial interaction so we can learn about the diagnosis, we can learn about the diet, and really we can customize the diet for what your lifestyle is. And then I do like to have a follow-up, and I try to make that follow-up within a few weeks. And some patients do benefit from more visits from there, depending on how things are going, but at least 2 visits to get started.
Oh, that's nice. We've talked a lot about diabetes. So March is National Nutrition Month, right? So thinking more broadly, what recommendations would you, let's talk about healthy choices in food. What recommendations would you make?
Yeah, I mean, there's all sorts of information out there about what you can do to be moving in the right direction for your health. But the best advice I can really offer is just to pay attention to what's in your food. If you don't know what you're eating, it's easy to not know if you're following certain rules, if you're hitting certain goals, and it's a great opportunity to figure out what's actually going in your body. So just to build that first habit, if something you're eating is unfamiliar or you're not sure what's in it, let's try to learn that.
Read the label, right?
Let's read the label, ask who made it, what's in it, and let's learn.
And shop on the outside of the grocery store, is that right?
Yep, another good tip is if you've been told something's good for you, sometimes it's harder to restrict the bad and to try to always be good. So, try to work in the good things, and the more often you work those in, then naturally some of those other foods might not have enough, you might not have enough room for them.
Well, that's great information. It will help I hope will help our patients to live longer, healthier lives. And it's been a pleasure to have you, and I'm going to research that, and we're going to get together and talk about that monitor. Thanks so much, Skip. I appreciate it. Please welcome Tammy Waterman, the clinical pharmacist here at Novant Health Brunswick Medical Center. Tammy, thank you for coming today. I've got so many questions about vaccines.
Well, I'm so happy to be here today, June. Thank you for inviting me.
Oh, you're quite welcome. Tammy, how did you get involved in pharmacy? What made you want to be a pharmacist?
Oh my goodness, good question. In high school, I actually took the Strong Vocational Interest Test. And that's a test that kind of tries to see how you think and compares you to people in different industries. And I scored really high in the medical field, although it did say I would be a really good mortician. I prefer living patients and talking to them. And what I really want to do is be able to educate people on how to take care of themselves, give them the control to do things to help themselves.
Yeah. Oh, that's a funny story, though. So tell us about your role here at Novant Health Brunswick Medical Center, and how long have you been here?
I've actually been here 1 year. I've been back at Novant for 2. I started off at Presbyterian before we were part of Novant back in the 90s.
Yeah.
So I'm a boomerang employee.
Yeah.
And I've spent several years at another large center in Charlotte, but I'm so happy to be back at Novant. And I'm one of the clinical staff pharmacists, so I work very closely with the nurses and physicians, just making sure that every patient gets the right medication when they need it and for the right duration.
Yeah, those are important rules, like red rules, you know.
Exactly.
So today we're primarily going to talk about vaccinations, all kinds of vaccinations. I think people are, when they hear the word vaccination, they think COVID. But we're going to talk about some other things, and I think that that'll be real interesting to a lot of our watchers. So let's start with pneumonia. How about that one?
Sure. The pneumonia vaccine is actually indicated for patients who are less than 2 years old and 65 and over if you don't have any other underlying health issues. But for patients who are immunocompromised, you can get it at any age. There are different products depending on the age. But the reason we want to give patients the pneumonia vaccine is so they don't get what we call invasive pneumococcal disease. These are bloodstream infections or meningitis or other types of pneumonia caused by specific bacteria. So this vaccine can actually prevent those things from happening.
Wow, those sound like terrible things that we don't want to catch.
They are terrible. They can be deadly.
Wow, I know I've had mine, and you only get it one time, is that right?
You only need it one time for the 65 and older patients.
That would be me.
Sometimes you can actually get it up to 3 times if you're immunocompromised.
Oh, okay. Yeah. Then we're going to talk about another one that I've already had, the shingles vaccine. And who should consider that and at what age?
Actually, for anybody 50 years of age or older, you can get the shingles vaccine. It's a 2-dose series, so we want you to go ahead and get it even if you've had an earlier vaccine called Zostavax.
I did.
It doesn't work, that one didn't work quite as well. The Shingrix vaccine is the newest one, and it actually will provide a minimum of 7 years of protection.
Wow.
Where we know that the Zostavax, the immunity really waned over time. So even if you've had chickenpox, or even if you've had shingles before, or if you got Zostavax, you can still get the shingles vaccine.
Yeah, I had chickenpox, but I've had the vaccine, and I certainly don't want shingles because I know somebody who had it, and it was horrible.
It is horrible, and it also can cause post-herpetic neuralgia, which is where your nerve endings feel like they're on fire. So this vaccine series can prevent that, and that's what we want to do.
That's awesome. Yeah, that's great. Yeah. So I know my grandchildren just got the HPV vaccine, and they're in their teens, they're early teens. So talk to me about that, and how does that, what does that do for them?
Sure. The HPV, or human papillomavirus vaccine, actually is the only vaccine we have that can help prevent types of cancer later on down the road. HPV, we know, can cause cervical cancer, penile cancer, anal cancer, and also some mouth and throat cancers. But by giving boys and girls the HPV vaccine before they've been exposed to the virus, so we want to start vaccinating as young as age 9, but typically age 11 to 12 is where we usually start because other vaccines are given at that time.
Right.
So all the vaccines can be given at the same time, we just want them given in different locations.
Oh.
But we do this, if everyone is vaccinated, we can prevent up to 90% of these cancers.
Wow.
So it's tremendous. It's a tremendous
That's
breakthrough.
a big number. That's a huge statistic.
Yes.
Man. Yeah, and if kids are still seeing like their pediatrician or their primary, typically around that time, they're before they're going to first day of school, and that's a great time to get them. And
Absolutely. And if parents want to just talk to their pediatricians, talk to their own providers about when they should get that. And adults can actually get vaccinated up to age 26.
Oh.
But you want to think about how much you like shots or don't like shots,
Yeah,
like
really.
most people do. If you're younger than age 15, you only need a 2-dose series. If you're over 15, then you need a 3-dose series.
oh, that's interesting. Okay, let's move on to the flu, but let's talk about the regular flu.
Okay.
The regular flu
Yes.
vaccine. I hear people say, well, I'm not getting that flu shot because I always get sick when I get it. Or then they get the vaccine and then they do get the flu later. So what's the advantage of having the flu vaccine?
Well, the flu vaccine is actually made using now 4 different types of flu strains. So there are 2 type A strains and 2 type B strains that are in the new quadrivalent vaccines. These new vaccines are also egg-free. So if you've had an egg allergy or didn't get the vaccine previously, definitely talk to your doctor. But the reason why people sometimes associate the flu vaccine with getting the flu is it often happens around the same time frame. And you can touch an elevator key without washing your hands and then accidentally scratch your face or touch your nose.
Yeah.
And the incubation time for the flu is usually 4 to 7 days. And after you get vaccinated, it can take up to 14 days for your immune system to ramp up.
Yeah.
So it's a little bit of an overlap. And we typically think of the flu season between November, even all the way out to May. So we want everybody to be vaccinated by the 1st of November.
I hate this, we're running short of time, and I wanted to at least touch on briefly on COVID-19. What are the latest recommendations for children getting the COVID vaccine?
At this point, we want everybody who's 5 years and older to get the primary series. That's with the Pfizer product that is FDA approved for kids, Moderna product, or with Janssen. Now patients can also get a booster shot if they're 12 years and older. And everybody is allowed to get a booster shot, which is the shot after your primary series.
Great. Well, that's all such good information, and I have more questions for you, but I'm out of time today. Will you come back? Because I want to talk about hospital safety and how we can take care of our patients and keep them safe when giving medications.
Absolutely. I'd love to talk with
You're
you
a
about
great
that.
guest. Thank you so much.
Thank you, June. It's so nice to meet you.
Nice to meet you. Now let's welcome Shannon Mathis, nurse practitioner at Novant Health Gastroenterology, Brunswick. Thanks so much for being here today.
Thanks for having me.
It's been ages since you've been here.
It has.
I think we just figured like 3 years or something.
Yep.
Too
Almost
long.
3.
Too long, Shannon. Too long. So, what in the world interested you in gastroenterology? Because you used to be in plastics.
Right. So I did some nursing and plastics and some med surg, different things with nursing. But I think at some point in time, everybody's kind of had some experience with a GI bug at least, or, some exposure to nausea, vomiting, diarrhea, or something like that. But for some people, those things become chronic issues. And being able to help people improve their quality of life and dealing with those issues is really what drew me to GI.
That's nice.
Yeah.
So you're at the clinic at Novant Health Gastroenterology. So tell me a little bit about your clinic and your role at the clinic.
So right now we have two doctors, Dr. Andrews and Dr. Futch. It's myself and a PA, Dottie Truax. So we are all there seeing patients. I see patients in the office primarily now, and so that's my day-to-day. And we're just a really tight-knit group of people that really value high-quality patient care.
It's a nice clinic. And,
Yes.
the physicians there are really nice too.
Yeah, we're nice to have them. They've joined the practice this past summer, so they've really helped round out the group nicely.
Yeah, that's great. So let's talk a little bit about the endoscopy center and what services are offered there. And that's a great place, by the way.
Oh yeah, so it's really nice. Been open for coming up on 4 years, I believe now. So freestanding endoscopy center. So not all of our patients have to come over to the hospital for their procedures, which is nice. Little caveat though, not all patients are eligible to have their procedures at the endoscopy center due to some medical issues, anesthesia requirements. But we offer upper endoscopy and colonoscopies that can be done next door. So the endoscopy center is attached to our office, so everything's there kind of in one place, which is nice. It's a little smaller setting, and that's all that we do there. So
it's quiet. You don't have all that hustle bustle.
I think
in the OR.
Very welcoming. Just a little less stressful environment for people to
because
be
that's
in.
a stressful procedure.
Right. I think people just get kind of nervous about that.
Yeah. Well, it's the prep.
Yeah. Right.
Well, that's a great overview. And I think next we're going to talk about acid reflux. I hear everybody say, I have acid reflux. What does that mean?
So I think, some people have acid reflux or heartburn kind of used interchangeably, Some people never experience that. Some people experience that more commonly, sometimes daily. Acid reflux or heartburn can be when acid from the stomach comes up into the esophagus and causes kind of a burning sensation in the chest. Or some people have a burning sensation in their upper abdomen. Some people have kind of a sour taste in their mouth or can kind of regurgitate food or things like that. And it can be triggered by diet, so certain things, spicy things, Italian kind of foods like red sauces, citrus things, alcohol, that kind of stuff.
How about medications? Can something like ibuprofen or something like that?
Right. So yeah, for some people it can, especially if you're overusing.
That'd be me.
Right. Some people don't have that issue, but more people, I would say than not, can be prone to some irritation from like ibuprofen or NSAIDs in general. Like BC powders, Goody powders, that kind of stuff.
So how does acid reflux versus GERD? What is GERD? Is that different or is that the same?
Symptoms are really similar, but I'd say GERD is more of a label that is used when acid reflux symptoms happen more frequently. So if you're having acid reflux symptoms more than 2 or 3 times a week, then you kind of get that GERD label. If you're having more severe symptoms, that you have the heartburn or the reflux with a nausea or vomiting or abdominal pain that comes with it.
Do you treat them the same or?
We typically start treatment with the same. Our mainstay of treatment is trying to eliminate the triggering factors. So if we know that there's a food or a medication like you mentioned or alcohol that may be triggering, we try to eliminate those things and see if symptoms improve. Sometimes, especially if people carry some weight in their midsection, we try to encourage weight loss or just changing timing of meals can help. So we try diet and lifestyle modifications first, but some people do need medications like proton pump inhibitors and things like that.
So if you have one of those, how do you know when to seek help at a provider's office?
I'd say if you're having symptoms that are not responsive to, the change in diet, changing the timing of your meals and, staying up later after you've eaten your meals, that kind of thing. If you're not getting improvement or you're having that nausea, vomiting, or trouble swallowing or that kind of thing, you should see a provider.
The last time you were here, we talked a lot about irritable bowel syndrome. That's hard to say. Or inflammatory bowel disease.
Right.
Are those the same?
So they're different. They're very different.
Really?
So irritable bowel syndrome, or IBS, is characterized, it's very different from person to person. And so some people have abdominal pain, some people have diarrhea, constipation, or a mixture of those things. And that can kind of wax and wane those symptoms and can be caused by dietary things for some people, can be related to stress, anxiety, depression, those kinds of things. There's a very strong connection between our guts and our brains called the gut-brain axis. And so if we're experiencing some increased stress or anxiety, it can manifest with some GI symptoms, whereas inflammatory bowel disease is more an autoimmune condition and a chronic condition that most people present with diarrhea, that they may have some bleeding in their stools, abdominal pain, and is treated differently with medication and a little different workup.
Well, this is March, and it is Colorectal Cancer Awareness Month.
Yes, ma'am.
So let's talk a little bit about that. Let's talk about colon cancer and how prevalent that is in this area.
Right. So colon cancer is becoming more common. We're finding it in more people, and there was actually a change in the recommendation for colon cancer screening last year. You know, we have a couple of options for colon cancer screening, but we do still recommend colonoscopy as the gold standard.
Well, that other option you just mentioned, that's the one I hear on TV with the box and the. So, how accurate are those, or do we have any data on that?
There's some data that's been collected, but there's some room that shows that there are some false positives as well as false negatives on those kinds of tests. I believe the current numbers are about 12-13% on both sides, so false positive and false negative on those kinds of tests. So they do have some room for error, much like lots of other testing, but colonoscopy allows us to directly visualize the colon, also allows us to remove any potential polyps that we may find. So it's the only test available that allows us to truly prevent colon cancer, because if we're removing those polyps, then they no longer have the potential to continue to advance into a colon cancer. And none of those home tests, allow that option.
The polyps, those are sort of a pre-cancerous
They can
type
be.
thing?
So there are different kinds of polyps, some are precancerous, some not. When we're doing the colonoscopy, we don't know just by looking at them if they're precancerous or not, so we remove them and send those to the lab to determine if they are or are not.
Probably if you're having symptoms, then you should have a colonoscopy.
Most definitely you should have a colonoscopy if you're having any symptoms.
So are you taking new patients?
Yes, ma'am, absolutely.
And how might our viewers make those appointments?
If anyone is in need of an appointment, they can simply contact the office. We don't require referrals for appointments. Some insurance companies may require referrals.
Yeah,
so, if that patient's specific insurance company requires a referral, they can simply ask for one from their primary.
And can they make an appointment with you?
Yes, ma'am.
So for their first appointment, that'd be fine. They can
Yeah, absolutely. Yeah, and we can talk about, if they have any specific needs or, any symptoms going on, we can address those, or if they're simply in need of a screening colonoscopy.
Yeah, great.
Yeah.
Well, thank you so much. Don't wait 3 more years to come back. And it's been a pleasure to have you.
Thank
you
you
do
for
a great
having
job.
me.
Thank you so
appreciate your
much.
help. Thank you.
Thank you for tuning in to HealthWatch. If you'd like more information on services provided by Novant Health, or if you're looking for a new physician, please visit our website at novanthealth.org. So until next time, stay well and have a great day.
In today's world, to move forward, you must constantly evolve. That's why we're changing for the better. ATMC is now Focus Broadband. At Focus Broadband, we're building better technology to connect you to a brighter tomorrow. And while our name has changed, our commitment to giving you the very best remains the same. Focus Broadband. We're focused on you.